People say a week is a long time in politics. I suspect at the moment Gordon Brown probably thinks an hour is as he watches Labour disintegrate in front of his eyes. But I want to remind Gordon of happier times. Think back to a year ago, a summer of fevered speculation, Labour riding high. Political paleontologists will call this PB, the pre-Bean era. Gordon had reinvented himself, Super Gordo, solving crises right, left and centre, crises like superbugs. He announced that the government would spend £50 million on a deep clean of every hospital. No doubt he'd use Flash to do the job. Flash Gordon, tough on grime and tough on the causes of grime. Sorry. Within days, The Lancet, though, had rumbled him. They condemned the plan as pandering to populism and bound to fail. It's cynical politics to spend public money on an initiative which has no clinical foundation. And the death toll from superbugs continues to rise. Now, you might dismiss this as a mere £50 million, a drop in the ocean in the NHS budget of £100 billion. But it's symbolic of Labour's failure of top-down bullying. And it's not just the cash. Every one of these politically driven initiatives drives doctors and nurses crazy. The latest example, well, by the end of the year, every primary care trust must have a polyclinic. Sorry, a GP-led health centre, we have to call them now. Irrespective of local circumstances, the views of local clinicians, patients and the community. It's that horrible mindset that Labour has of we know best, but invariably they get it wrong. Labour are more interested in management consultants than in medical consultants. They micromanage everything. They measure and monitor anything that moves and lose the sight of the fundamental importance of care. Just look at the facts. Over the last 11 years, health spending has increased threefold. Vital after the Tory years of neglect. Yet the NHS is still failing too many people. People like Barry, he's a constituent of mine. I've got to know Barry and his wife very well. He's a brave man whose working life was dedicated to saving the lives of others as a London firefighter. He's now retired, moved to Norfolk. Sadly, he has liver cancer. His specialist recommended a drug that's readily available elsewhere in Europe. But an unaccountable body, the local PCT, said no. And when we asked what would happen if he took his doctor's advice and paid for the drug himself, we were told that his NHS care would be withdrawn. That cannot be right in the NHS, and it will not happen in our people's NHS. Now, we appealed that decision, and we won. But this took months while Barry was denied the treatment he needed, and his family suffered the deep worry not only of his condition, but also his fight for justice. Now, I'm glad that Barry won his battle, and he's now having his treatment. But his story is not unique. Right now, there are just too many people facing life-threatening illnesses and having to fight these battles. This has to change, and under a Liberal Democrat health plan, it would change. It disgraces this government that more British women die of cancer than in Slovakia, Lithuania or Latvia. You're more likely to die of a stroke or heart disease in the UK than in Korea or even Mexico. Those with mental health problems often suffer intolerable delay waiting for therapy. Many are inappropriately put on pills as the only option available, particularly if they're unlucky enough to be old. Now, the failure to reform the pernicious means testing of care in old age is a continuing scandal. But all of those is just a start. We face the perfect storm in healthcare. On the one hand, we have an ageing population and new and expensive treatments, plus the lifestyle challenges of obesity, smoking, alcohol and drug abuse. These all add up to a massive increase in cost pressures on the NHS. And on the other, no government can solve these problems just by throwing more money at them. We have to find a way of navigating our way through this perfect storm, because if we don't, the consequences for the most vulnerable in our society are unimaginable. This is a matter of life and death. And whenever the cash runs out, it's always the most disadvantaged that suffer most. So our challenge is to make the most effective use of the resources available. And there is real potential. Health economists argue that you can achieve efficiency savings of up to 10%. That's £10 billion. And the evidence shows that Labour's NHS is becoming more inefficient. It wasn't meant to be like this. 60 years ago, a remarkable Liberal, William Beveridge, had a vision: a universal healthcare system available to all, funded by general taxation. We call it the NHS. But this vision is now at risk because of these cost pressures. Neither of the other parties will respond. Labour offers more of the same: hectoring, bullying, wasteful and ineffective. As for the Tories, well, they'll take away the sole elected person in the NHS and impose a centralised quango, a sort of child support agency for the health service. Add to that their unattractive moralising. It's your fault seems to be their message. So Labour can't and the Tories won't. Just as Beveridge did 60 years ago, I want us, the Liberal Democrats, to take the lead in showing the way forward, spending resources more effectively, creating a people's NHS that belongs to communities and puts their priorities first. Our approach, a liberal approach, sees a fundamental shift of power from Whitehall to communities and to individuals. First, we'll dismantle the wasteful and centralised NHS bureaucracy and give power back to local communities, to introduce proper accountability for the first time. Primary care trusts, health boards as we call them, or local authorities if people so choose, efficient in performance and accountable to the people they serve. We'll abolish strategic health authorities. We'll axe NHS quangos, the HMAC, the IRP, the CHRE and the CCP. So it's goodbye to the gravy train of defeated politicians who run so many of our quangos. And it's goodbye also to the national IT programme, which has wasted and will waste billions of pounds. Besides, who would trust this government with a national database of our medical records? Instead, we'll focus on connecting up health and social care locally, building from the bottom up, just as they've done in Sweden. And we would end the crazy divide between health and social care. Our proposed health boards would have a legal duty to deliver value for money in securing high-quality care for the communities they serve. They'd be free to commission services from a range of providers to secure improved quality of care and value for money, just like innovative Liberal Democrat councils do today. And our key difference